So today's info bite is about stages of fracture healing. Through these processes only, normal fracture healing occurs. At the fracture site, there will be breach in the normal lining of the blood vessels where there will be leakage of blood. And to achieve hemostasis, there will be chemical signaling, platelet aggregation will happen, and all these processes will lead to hematoma formation. Along with that, at the fracture site there will be another process is going on, which is in osteocytes. We know osteocyte is an bone engineer. It will look after the bones, and osteoblast it is an bone builders. Osteocytes will differentiate into fibroblast, and these will later aggregate, and aggregation of these fibroblasts and other growth factors and platelet will form the granulation tissues, and these process will happen within 2 to 3 weeks. And after that, we know anything is broken, it has to be repaired. To repair that, there will be osteoblast functioning, which will form callus. Callus is nothing but an fibrocartilaginous material which is made up of collagen fibers. The function of a callus is to bridge between the two broken fracture sites. It will bridge the fracture site and trying to repair it and build it up to form a new bone at the fracture site. At first there will be soft callus. Later on there will be mineralization of calcium into the soft callus, which will later form the rigid hard callus. And this repairing will goes on and on until there will be remodeling. Remodeling is nothing but consolidation or strengthening of the fracture site with the bone cells, and these bone cells will form an immature bone at the fracture site. It will try to connect the fracture site ends with an immature bone, and we call it as also as woven bone, because the arrangement of those osteocytes and collagen fibers at the fracture site, it will be randomly arranged, not an lamellar arrangement. In mature bone only we will see an lamellar arrangement. For that to achieve, it will take some more years. Last only we tell it as it's a modeling phase is occurring, or reshaping is occurring, where there will be endosteum and periosteum surface modeling will occur. Through these processes only we will achieve a normal fracture healing. At end of the phases, we will have a mature bone where it will be formed in the fracture site. Here you can see this is the picture of an osteocyte, or you can see osteons in it, which is in structural unit of one bone. And here you can see a callus, these soft fluffy things around the fracture site. Here this is the fracture site. Those fluffy material you see in an extra picture, we call it as a callus. So from this we can have a question: what is the phase of fracture healing we see in this X-ray picture? Like that they can ask. Thank you.